Thank you. The show is Health Access. My name is Akin Fadeyi. I'm health insured and it's paying off. Is it not showing on me? Thank you. I got big masquerades on the program. Please welcome the former Minister for Health in Nigeria, Professor Eyitayo Lambo.
Good morning. Hello, Akin. How are you? Morning, guys. How are you doing? You look cool from here.
Thank you very much. Please welcome Chief Medical Director, Lagos University Teaching Hospital, Professor Akin Osibogun. I have a co-host, Gbenga Adeyinka, the first. Gbenga, are we in the law court today, or we should just let them go?
No. On behalf of the good people of Nigeria, I would like to thank you for the good job you have been doing. But first, you need to do something for me. I'll start with Professor Osibogun. Please raise your right hand and say after me. I, Professor
Akin Osibogun,
promise to tell the truth.
promise to tell the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but
Let's give it to him. Sir, it's my pleasure, my honor, in fact, my body they shake, to ask you to raise your right hand and say after me. I,
Eyitayo Lambo,
promise to tell the truth. The whole truth.
The whole truth.
And nothing but the truth.
Nothing but the truth.
And so help you God.
And so help me God.
They are men of honor, integrity, cashew, juggernaut, iroko, and all that. They have promised.
Professor Lambo.
Yes.
October 30, 2013, you said that the Constitution of Nigeria was faulty. Were you trying to say that the tiers of government in Nigeria frustrate the NHIS project?
The past constitutions, as well as the one we are operating right now, have not indicated, have not spelled out clearly the roles and responsibilities of each tier of government with regard to health, hereby stepping not just on their toes, but on their fingers and their heads. Therefore, the relevance of this to the national health insurance is that you cannot meaningfully implement the national health insurance that wants to make, financial access, physical access easy for all Nigerians. These Nigerians live in various communities, communities in local governments in states, and states under the federal, without clearly defining what each level should do.
Why do you think that a state governor will not cooperate with the federal government to ensure that the people it governs access quality health care on health insurance platform?
It's not a question of not cooperating. The state is not mandated or compelled to cooperate with the federal government. And take an extreme case whereby a particular state is controlled by a party and the federal government is controlled by another party. It depends on the individual in that state. Otherwise, that governor in that state, which is not the same, who is not in the same party with the party in power at the center, they owe allegiance more to the party, than to the federal government, to the president.
You also said recently that 30 Nigerians are dying per hour from cancer. Why cannot big players like you rally around Nigerians by seeking financing for the health of poor Nigerians?
I must commend you for this debate, and I think we need, as a people, to reach an agreement as to how we want to finance health. Health cannot be financed solely by governments in any part of the world. Health is a shared responsibility. Individuals, families, communities, and governments must cooperate to determine and to design the kind of financing structure that they want for their country. And from our experience, we've seen that the method or mechanism of financing that removes stress on families and individuals would be a kind of health insurance program. So what we all need to do is to now agree that we must pool resources and share the risks. And that way we prevent or save people from having to be challenged financially when they are healed.
All right. Thank you. The show is Health Access. My guests are Professor Eyitayo Lambo and Professor Akin Osibogun. We'll be right back. We're going on a short break.
She find pass Oyinbo queen, no rival.
Baba, your wife is coming.
Hospital bills. Da kin yi register da NHIS. Da yanzu ba kya asibiti bill. Ìbá ṣe pé wọn náà ti darapọ̀ mọ́ ètò ìlera adójútòfò NHIS ni. Ó ní máa pariwo owó hospital bill.
Ọ bụrụ na ị dere aha gị n'akwụkwọ ndị NHIS, ị gaghị nọrọ ebe a na-eti mkpu hospital bill.
And my dreams dey always come true. I dey go register for the NHIS.
What do you know about the SES?
Na NHIS. Government don dey arrange better thing wey you go benefit from. Me and Linda, we no go dey suffer for hospital bill again.
NHIS, easy access to healthcare for all.
Welcome back. The show is still Health Access. Professor Osibogun was addressing the issue of health financing. You said that out-of-pocket payments will deny poor Nigerians of accessing health care. Maybe you want to also make a comment on Professor Osibogun's comments.
A situation whereby a country depends largely on the external world for financing anything, and health is one of them. It's not ideal. It will not be sustainable, and so on and so forth. Health financing should be a collective responsibility in the sense that even individuals, because your health, your state of health or e-health is dependent on your action or inaction. When you eat pounded yam 3 times a day, okay? And when you drink whiskey as if you are drinking water, and when you smoke cigarettes like a chimney house, then you are determining your own health. You cannot say it's your father's second wife that is responsible for this. Okay, so the individual, the family, the community, they have a role to play in making the people healthy. And therefore, they need to make some contribution to this. But having said that, the major responsibility should lie on the government. Okay, because these are citizens of the country, and good governance, will demand that government, plays its role in ensuring that the people are entitled to certain things. One of which is good access or free access to quality health services.
What do you think is the major challenge inhibiting health insurance in Nigeria?
Lack of awareness. The people have to be educated. There are also cultural factors and religious factors. This feeling that you can never be healed. And I don't know where people get that feeling. I think it's just a want or a wish never to be healed. But we must recognize that there's no human being that will live for 80 years and will never be ill for one day throughout those 80 years.
All right, so lack of awareness, cultural
and religious
issues. So, my friends, stop saying it is not my portion. I cannot fall sick.
You know the stone.
Stop saying so. Professor Lambo.
Yeah.
Rwanda has 99% health insurance coverage now. Ghana, 67%. You came with a lot of zeal. Why? What is wrong with Nigeria?
You are right. Ghana and Nigeria started thinking about health insurance about the same time. Indeed, we passed our own act in 1999. Ghana's act was 2003 or thereabout. Okay? Rwanda started talking about health insurance the same year, 1999. What did they do in Rwanda? What they did in Rwanda was that there was good political leadership. There was political commitment. I am an economist. When a politician tells me I am committed, politically I'm committed to this, that does not make any meaning to me. Because you have to put your money where your mouth is. So until this is translated to Naira and Kobo, I don't take you seriously. So the leadership of Rwanda took it seriously. They developed a policy, all right? They developed a legislative framework for the policy, and they put in and mobilized the people. So what has happened in Rwanda is that almost everybody that is covered now. And for the premium contribution, the individuals pay only 1/3 of the contribution. Government matches it with about 1/3. And the partners match that with about 1/3. So if we are talking about 3,000 naira per person per year, the individual is paying only 1,000, partners are paying 1,000, and government is paying 1,000.
We'll be right back.
My wife fine yo, she no get tattoo. She fine pass oyinbo queen, no rival.
Baba, your wife is coming.
Hospital bill. Da kin yi register da NHIS. Da yanzu ba kya asibiti bill. Ìbá ṣe pé wọn náà ti darapọ̀ mọ́ ètò ìlera adójútòfò NHIS ni. Ó ní máa pariwo owó hospital.
Ọ bụrụ na ị dere aha gị n'akwụkwọ ndị NHIS, ị gaghị nara ebe a na-eti mkpu the hospital bill.
And my dreams dey always come true. I dey go register for the NHIS.
You go school? Wetin you know about SEs?
Na NHIS government don dey arrange better thing wey you go benefit from. Me and Linda, we no go dey suffer for hospital bill again. I dey go register for the NHIS. Now, everybody can register. Bus driver, mechanic, trader, anybody.
Easy access.